Hey everyone, welcome back. Today we're diving into a topic that's super important but often overlooked, our kidneys. Did you know that these little bean-shaped organs are vital for keeping our bodies healthy? We're gonna break it all down, easy peasy, so you can become your own health advocate. We'll explore common kidney problems, how they affect us, and what we can do to keep our kidneys in tip-top shape. So, grab a snack, sit back, and let's get started. Let's kick things off with chronic kidney disease, or CKD. This is a gradual loss of kidney function that often flies under the radar. CKD can be caused by common conditions like diabetes and high blood pressure. Regular checkups are key, my friends. Don't skip those appointments. Watch for signs like fatigue, swelling, and changes in urination. If you notice any of these symptoms, see a doctor. Early detection is key to managing CKD. Be proactive about your kidney health. Next up is acute kidney injury, or AKI. This one's a bit different from CKD because it happens suddenly, kind of like your kidney slamming on the brakes. It's usually triggered by something specific, like severe dehydration, a bad infection, certain medications, or a sudden drop in blood flow to the kidneys. Think of AKI as your kidneys sending out an SOS signal. They're saying, help, we need some backup over here. Luckily, if we catch AKI early on, the kidneys can often recover and bounce back to their normal selves. But here's the thing, we gotta be quick on our feet. Symptoms of AKI can include a decreased urine output, like you're barely going to the bathroom, swelling in those same areas we talked about before, and even confusion. That's right, AKI can mess with your brain a bit, so if you or someone you know experiences any of these symptoms, don't wait it out. Get medical help right away. Time is of the essence with AKI, so early intervention is crucial for giving those kidneys the best chance of recovery. Now, let's talk about something that can cause a lot of pain, kidney stones. These little guys are like tiny, hard pebbles that form inside your kidneys. They're made up of things like calcium, oxalate, and uric acid that clump together when there's not enough fluid in your kidneys to flush them out. You know what that means, right? Dehydration is a major risk factor for kidney stones, so make sure you're drinking plenty of water throughout the day. And speaking of things we should be limiting, a high salt diet can also increase your risk of developing these pesky stones. Now, when it comes to symptoms, let's just say kidney stones don't exactly make their presence known subtly. Think intense pain in your back or side, like a stabbing or cramping sensation that comes in waves. You might also notice blood in your urine, yikes, and feel nauseous or even throw up. But hey, there's a silver lining here. Drinking plenty of water can actually help prevent kidney stones in the first place. So stay hydrated, my friends, and keep those kidneys happy. Glomerulonephritis. When inflammation strikes, moving on to glomerulonephritis. This one's a bit of a mouthful, but basically it means that the tiny filters in your kidneys, called glomeruli, are inflamed. These little filters are super important because they help remove waste and excess fluid from your blood. Glomerulonephritis can be caused by a few different things like infections, autoimmune diseases, or even certain medications. And just like with CKD, it can sometimes develop silently without any noticeable symptoms in the early stages. But as it progresses, you might start to see some telltale signs like blood in your urine. Remember how we talked about that with kidney stones? Yeah, it's it's not a good sign. You might also notice that your blood pressure is higher than usual. So if you have any reason to suspect glomerulonephritis, it's crucial to see a healthcare provider for a proper diagnosis and treatment plan. They can run tests to figure out what's causing the inflammation and recommend the best course of action. Have you ever heard of polycystic kidney disease, or PKD? This one's a genetic disorder, which means it's passed down through families. People with PKD develop multiple fluid-filled cysts in their kidneys over time. These cysts can range in size from tiny, almost invisible dots to larger ones that can grow quite large. Now, here's the thing about PKD. It can be sneaky, especially in the early stages. Many people don't even realize they have it until they develop symptoms later in life. But as those cysts grow and multiply, they can start to interfere with your kidney's ability to function properly. Over time, PKD can lead to high blood pressure, kidney stones, remember those troublemakers, and even kidney failure in some cases. But don't worry, it's not all doom and gloom. Regular monitoring and early management are key to living a long and healthy life with PKD. So, if you have a family history of PKD, talk to your doctor about getting screened. Let's not forget about urinary tract infections, or UTIs. These pesky infections are incredibly common, especially among women. They can affect any part of your urinary tract, including your bladder, urethra, and even your kidneys. UTIs happen when bacteria, usually from your skin or rectum, make their way into your urinary tract and start multiplying. And let me tell you, they can really put a damper on your day. Symptoms of a UTI can include a frequent urge to pee, even if you just went a burning sensation when you urinate. Ouch! And cloudy or strong smelling urine. In some cases, you might even experience pain in your lower abdomen or back. The good news is that UTIs are usually easily treatable with antibiotics, but it's important to catch them early on to prevent the infection from spreading to your kidneys. So if you suspect you might have a UTI, don't hesitate to reach out to your doctor. Lastly, let's talk about kidney cancer. While it's not as common as some of the other kidney conditions we've discussed, it's still important to be aware of. The exact causes of kidney cancer aren't always clear, but certain factors can increase your risk, like smoking, obesity, high blood pressure, and family history of the disease. Now, here's the tricky part. Kidney cancer often doesn't cause any noticeable symptoms in its early stages. But as the tumor grows, you might start to see some signs like blood in your urine, a recurring theme today, a persistent pain in your back or side that doesn't seem to go away, a lump or mass in your abdomen, unexplained weight loss, fatigue, or loss of appetite. Early detection is crucial when it comes to treating kidney cancer successfully. So, if you experience any of these symptoms, don't brush them off. Make an appointment with your doctor to get checked out just to be safe. Let's talk about keeping those amazing organs in tip-top shape. Here are some tips. Stay hydrated. Drink plenty of water throughout the day. Eat a balanced diet. Focus on fruits, veggies, and whole grains. Exercise regularly. Aim for at least 150 minutes of moderate intensity exercise each week. Monitor blood pressure and blood sugar. Keep these in check with regular checkups. Avoid smoking and limit alcohol. Both can harm your kidneys. Stay informed, be proactive, and take good care of those incredible kidneys.